Now, moving on to our event, I'm very pleased to introduce Stephen Lee. Stephen has been an acupuncturist for 35 years and a Chinese herbalist for 30 years. He has been interested in electroacupuncture for most of that time and developed ways of using it to treat musculoskeletal problems. So some of the techniques were published in the European Journal of Oriental Medicine in 2009 and later in the Journal of Chinese Medicine. As a result, he was invited to teach in various colleges and present workshops to share his ideas. In 2018, he published these techniques in his book, The Electroacupuncture Handbook. The handbook has had outstanding reviews. So Stephen, thank you so much for being here today. I will now hand over to you, please.
Great, thank you. Thank you very much, Charlene, for that introduction. And I'd just like to, well, I'm delighted that so many people have joined this webinar this morning. This is the first webinar I've done, so it's kind of strange sitting in the privacy of your own home, speaking to what I imagine are loads of people out there. So anyway, the format is going to be me doing an introduction, and then we're going to open it up for questions. So I really appreciate your interest in this subject, because I think it is a very much underused tool, and it's an important and effective form of treatment that we can easily add to the work we're already doing. Of course, I'm also here to promote my book. Here it is. The Electroacupuncture Handbook for Muscular and Skeletal Problems. I believe it's a standalone therapy that in its own right, and so it can be used by not only TCM practitioners, five-element acupuncturists, but also physios, osteopaths, chiropractors, it is a fusion of muscular skeletal acupuncture, and I was quite struck that the first person who came on during this meeting was Kevin Young, who was one of the people who taught me musculoskeletal acupuncture many years ago. So it's nice to see you here, Kevin. The book is a fusion of muscular skeletal type acupuncture and electroacupuncture itself. So what it is not is a meridian-based system, or if you like, a Chinese organ-based system of treatment. So it very much stands alone and can be added to those things. Now, I remember in my early days of practice, which was in the 1980s, which to me doesn't seem that long ago, but actually it's 40 years ago. In the early days of my practice, I felt I was doing really well with internal problems, digestive problems, asthma, rheumatoid arthritis, headaches, migraines, that kind of thing. But the area that I felt I wasn't doing as well as I thought I could was musculoskeletal treatment. And that very much presented itself as the dreaded frozen shoulder, which is probably one of the most difficult and intractable musculoskeletal problems that we encounter. And I was in China in 1987, and I remember treating one of those wiry guys who push those carts around that are piled high with boxes, and we were having problems treating his frozen shoulder as well. I think the other thing that I would like to say is that many of our patients come specifically with musculoskeletal problems, and if we can treat them effectively, and quickly, not only do we have a very satisfied patient, but it gives us a lot of satisfaction, and ultimately that will lead to us having, a busy practice. So eventually I combined electroacupuncture with musculoskeletal treatments, and found that I was getting even better results than just with the musculoskeletal treatment alone. And in a way, if we compare this to Chinese herbal medicine, in Chinese herbal medicine, we have qi moving herbs. which move in a more superficial way than blood moving herbs. So in the same way that I see manual acupuncture in some ways as chi moving, I see electroacupuncture as blood moving. So it's deeper, it's more penetrating. So what are the advantages of electroacupuncture? Well, the first one is that it is more effective. I know that because patients tell me, especially if I've done a manual acupuncture treatment on them and then electroacupuncture treatment, they tell me that it worked better and it lasted longer. Now, probably like many of you, we have people coming with osteoarthritis of the hip. They might have had the problem for 2 or 3 years. They're probably waiting for an operation. They're not only in pain at night, but they're in pain during the day after standing or walking too far. Now, these patients, if you treat them with electroacupuncture, you can completely get rid of the pain and you can maintain them pain-free for up to 3 or 4 weeks with just one treatment. So obviously you've got to do the initial treatments to get things moving. But once they're doing well and pain-free, I've had a number of patients who've gone all the way to the actual operation and have said to me before the operation, I'm still in hardly any pain. I'm in less pain than I was 2 years ago. So, you know, if you can help a patient in that way, that is brilliant. I think the other thing about electroacupuncture, it is more targeted and it goes deeper into the body, because if you pass electricity from one wire to another via the needles, then the electricity actually passes through the body. You know, sometimes a treatment doesn't work, not because we're doing the wrong treatment, but simply because it's not strong enough. And so, you know, if you were treating a knee joint, now with knee problems, people often have considerable damage inside the joint itself, maybe with the cartilage or with the cruciate ligaments. And when we're treating them in a more constitutional way, it takes time for the effects of treating their constitution to start to have an effect on the knee, or it can do. That's not true all the time, but I'm talking where the knee has become quite damaged. Now, if you pass electricity actually through the knee joint itself, a little bit like having an arthroscopy and kind of flushing out the joint, then you will speed the treatment up, and then they'll get off the couch and say, you know, is it meant to happen straight away? And of course I say yes. Of course it doesn't always, but so it can be incredibly effective. Now, the other thing about electroacupuncture, I'd just like to say, is that if you set it up properly, i.e. don't make it too strong, then the patient can have this pleasant therapeutic experience, because what they're essentially feeling is pulsing or tingling running through these areas that they're having a problem with, which of course is very reassuring to them, because they're feeling that the area that is the problem is actually being addressed. And so that's reassuring to the patient as well. And of course, once you've learned the principles outlined in the book, you can, of course, apply them to, you know, to the patient in front of you, because, you know, they're all different. And we probably all come across, we probably palpated a back, and we found muscles in the back that are so tight that they've almost become fibrosed. They've almost turned into like tendons. And very often you must feel, well, you know, how am I going to soften that muscle? Is cupping going to do it? Is manual acupuncture going to do it? Is massage? And of course, when you introduce electricity into a muscle, you start to initiate the contraction and relaxation of the muscle using the electricity itself. So you're kind of taking over from the natural stimulation of the muscle. So you start to get the things moving. So just one last thing I'd like to say before opening things up for questions, and that's about electricity itself. Obviously, because we live in this modern era and we've all had electricity all our lives, we in some ways don't see how extraordinary electricity itself is. It's an invisible energy that can do extraordinary things. And if we've been born in the 18th century, when they managed to generate it and store it, and they saw that it could stimulate a frog that was dead, they could move the muscles in a frog. They thought they'd actually discovered the very life force itself, which in some ways they had. And I think that our biological model of the body, which is to do with the movements of fluids, storage of fluids, movement of blood, we very much see as a kind of more of a chemical reaction. But we must remember that not a heartbeat happens, not a movement. We're completely animated by electrical impulses. Not a sensory perception happens without there being electrical impulses. So to me, it seems perfectly sensible, reasonable to use electricity to treat the body. So the last thing I'd like to say, that was meant for the last thing, but this is the very last thing I'd like to say is I'd just like to say a bit about the book itself. This is called a handbook because it's very much a book that you can pick up and use, because it's designed in such a way that there's a step-by-step guide guiding you through each treatment for many of the joints in the body. Well, there's lots of diagrams, there's case histories as well. So it covers specific conditions, and also there's a section on what I've called difficult and unusual cases. Now in this section, it's not just musculoskeletal. So it's treating things like post-hepatic pain and Dupuytren's contracture. So that just gives you an idea of in what ways electroacupuncture can be used for other things. And I think that this is an area that is open to be explored. I've tended to stick with the musculoskeletal. So I think that's plenty of an introduction. I'd be very happy to respond to your questions. Thank you.
Just looking at the chat function, you have a message from Tanya. Tanya, would you like to pop on your microphone and your video to ask Stephen your question?
Okay, here I am.
Hi,
Thank
Tanya.
you.
Hi. I'm just going to say that I have written in that written question. I contacted you some time ago asking about electroacupuncture for joints or around joints that already went through hip replacement and knee replacement, and you said that I was the first one to ask. So I was just asking in my question if you have any clearer view now.
Oh, so the question is essentially, I think, is would I treat someone who'd had a hip replacement or a knee replacement with electroacupuncture?
Yes, but if the pain is in that joint or around the joint that went through, so would you use the contralateral side, hopefully, or what about electroacupuncture and actually repair or change joint?
Yeah, okay. So the only experience I've had of this, I've treated a number of people with electroacupuncture within days of them having a hip operation. Now, generally speaking, I haven't been passing electricity through the joint. There's no reason to, in the way that's outlined in the book.
So but that's the question. That was the question. Yeah.
Yeah. So I have used electricity to treat the scar tissue, and it is extraordinary how much it starts to free up the inflammation, the adhesions within the scar itself. But in a sense, that's not a muscular. Well, it is a muscular problem. but I wouldn't see any reason to pass electricity through the joint itself, because that's often not where the pain is. But I do know that physios don't suggest you use electricity around metal joints, but for me, I can't see why not. It may conduct the electricity a bit better, a bit deeper into the body, but I can't see any reason not to do it, and haven't had any adverse effects myself. Okay.
Thank you.
Okay. Does that answer your question? Yeah.
Yep.
Thank you, Stephen. Are there any questions from anybody else at all?
Hi, my name is Anita. Can I have a question, please?
Yeah.
Hi, I was hoping to ask about rheumatoid arthritis and inflamed joints.
Yeah.
I don't know if you elaborate because I was a few minutes late, but would you use electroacupuncture when they have the flare-ups? Or what, like if you at all recommend that for rheumatoid arthritis?
Yeah, I mean, for me, treating rheumatoid arthritis is I would treat them in a normal way from a TCM point of view, definitely, because this is a systemic problem. And the systemic problem is having obviously a systemic effect on probably many of their joints. And so particularly if there's heat in the joint, if there's inflammation, then and there's inflammatory conditions within their whole body, I would first of all address that. So I wouldn't necessarily leap in with electroacupuncture in a problem like that. So this means that, you know, if it's more than one joint in the body, then it's probably systemic. If it's just one joint, then it's probably a localized problem, and it's good to address it in a localized way with electroacupuncture. But I mean, with any patient that I treat, I always treat them constitutionally from a TCM perspective, because that's going to speed things up. It's almost like, I've just thought of this analogy. If someone is having IVF, then obviously the doctors are implanting a fetus, implanting the embryo, and so they're dealing with the specifics of that. And when we treat the patients, we're treating their constitution. So electroacupuncture is doing something specific to the joint, and constitutional treatment is doing something else. So a combination of the two is excellent. Does that answer your question?
Yes, I just just further on the question. What if the just because I'm working on a specific patient whose medication got the treatment, got the disease under control. She's doing acupuncture. We've been doing the constitutional treatment. Now, because she has had L4 and L5 slip disc,
Yeah.
and because of the rheumatoid arthritis, the vertebra has gone a little bit deformed. So it's just the L4, L5, which is the combination of the slip disc and the rheumatoid arthritis. I wasn't sure if it's then playing with fire if I put the acupuncture, electroacupuncture there.
No, I would certainly treat this, especially as you've already been treating her and she's still having a problem. Then obviously you need to do some more. You know, I mean, I suppose I question this idea of people having, you know, rheumatoid arthritis in their lower back in the same way they have rheumatoid arthritis in their knees. I mean, I think some of these things are more predominantly musculoskeletal problems. So in my experience, most back pain, probably 80 or 90% is predominantly musculoskeletal. So there's a lot of tightening in the lumbar muscles, you know, and so this is causing contraction in the lower back, which will of course cause inflammation as well, which we could call rheumatoid arthritis. But addressing the muscles and understanding where the muscles are will make your treatments of back pain much more effective. You know, not all back pain is kidney deficiency. Not all back pain is the accumulation of damp heat or damp cold in the back. You know, or it's not generally liver qi stagnation necessarily. Treating those things, if they have them, will enhance your treatment, but sometimes we need to go and address the specific muscles that are causing the problem. And you know, I think a large muscle in the body that is in chronic contraction can almost cause as much stagnation as an organ that is chronically unhealthy in a way. I don't think we should see the muscles of the body as a secondary thing that we treat. It could be a primary thing. Was that a rather complicated answer?
No, thank you so much. Very clear. Yeah, but because most of the practitioners she saw before me, they've been treating her for kidney deficiency, whereas the tongue and pulse doesn't show any kidney deficiency anymore. So it's definitely musculoskeletal problem. So I'm gonna use electroacupuncture.
But I even think that even in TCM terms, to think of backache to be primary kidney is not necessarily a good idea. You know, if somebody's got severe liver qi stagnation, I mean, that's enough to tighten the back muscles up and cause problems.
Thank you so much. Very helpful.
Pleasure. Thank you.
Thank you, Stephen. We have a question from Adam. Does the book cover EA for IVF or scalp acupuncture? Adam, would you like to pop on your microphone and video so you can talk to Stephen?
Adam.
Yeah, I'm here.
Oh, hi, Adam.
Good morning.
Morning.
Thanks for the intro. Yeah, just the chapters covering the different uses of electroacupuncture. Does it embrace the use for IVF and scalp?
No.
Okay.
But I have an interesting comment about, is this presumably electroacupuncture to stimulate the ovaries?
Potentially.
Yeah, I mean, I think this is quite interesting because I think there's a kind of bigger question here. And that is something to do with, is it possible to stimulate the meridians electrically? Because I think the treatment to stimulate the ovaries is a much more localized physical treatment. It's nothing to do with the meridians.
Mm-hmm.
And so, you know, I think this is a whole different area, treating meridians with electricity. My experience of trying to do it, which is of course the way I started, it didn't enhance manual acupuncture at all. In fact, sometimes it made it worse. I particularly remember one lady that I've been treating for menopausal symptoms, and she'd been doing really well. And then on one treatment, I decided to do Ren Mai, lung 7, kidney 6, with just gentle electroacupuncture. And immediately all the symptoms came back. And we often see these kind of research papers where they've said they've done electroacupuncture from liver 3, colon 4, those kind of treatments. And they never really say how the pairs are being attached. And to me, who knows what's happening in the body and where the electricity is running to and from? So the short answer to your question is no, it doesn't cover it in the book.
Okay, and scalp acupuncture is a similar response?
Yeah, it's not in the book, but okay. There are plenty of other places where you can find out about scalp acupuncture, of course. Yeah.
So in the book, do you share the use of the electroacupuncture machine in terms of the gigahertz that you would have it on at, and the frequency and the length of time and so on?
Yes, yeah, absolutely. But this is a very difficult area to get to the bottom of. So a lot of research was done in the, was it in the 80s or the 90s in China to find out what are the best frequencies to use. And this is the holy grail of electroacupuncture in some ways. What frequencies do we use? So for 20 years, I had it, or 15, 20 years, I had my machine set on dense disperse, which basically means that you have one frequency followed by another, and it alternates. And frequency with electroacupuncture machines means the rate at which the electricity changes direction, because it's basically alternating current, which means the electricity moves one way, then it moves the other way. So I had it set on 90 hertz and 30 hertz for many years, and I got very good results. Then I started to think about it a bit more and read the research, and none of it was clear. So my conclusion of the whole thing was that when we're treating actual muscles as opposed to joints, we set it on a low frequency, like 6 hertz and 2 hertz, dense disperse. This is to initiate some kind of gentle muscle contraction. It may be kind of subliminal, so you can't see it, but you're not passing a higher frequency through the muscle, which could cause some contraction that you don't want. So, but when I'm treating something like frozen shoulder, I would use much higher frequencies, as though with the idea that the higher frequencies are more penetrating. So, and you don't need to worry about muscle contraction.
So higher frequency, are you then making the connection that that's more blood moving?
Well, kind of.
Right.
But the research tells us, and this is not conclusive, the research tells us that higher frequencies treat pain predominantly. So, so if you like, that's the way I rationalized it in my own mind.
Okay.
And so I do talk about that in the book, but I also explain that this is just my own conclusions.
Yeah.
But of course, are not conclusions, because the book is, a work in progress. Because electroacupuncture is relatively new in the world of acupuncture.
Okay.
The first record of it was 1749 in Japan, strangely enough. So it's still modern.
That doesn't feel modern, but okay. Excellent. Okay, thanks for sharing that.
Okay, thank you.
So I was talking about the intractable problem that we all face, and I face it several times a week as an osteopath. How effective, and I used electroacupuncture. I do have electroacupuncture machines, sort of gathering dust, and I've used it in the past, and I haven't really, to be honest, found it that effective. Or I did for a while, then didn't. I wasn't, and there was question about frequencies and so on. So I've never been sure about it, and sort of left it alone and sort of found my way working on it without electroacupuncture. I do use acupuncture. I'm not sure always how effectively. So the question is, how effective is it? And does it depend on the diagnosis of the actual pathology?
Okay. The first thing I'd like to say is this is the least effective technique in the book.
Right.
So in some ways, it's still my holy grail. And you've probably read interesting research yourself that relates it to kind of deep emotional stuff, and that shoulders have been released by, other techniques. So it's very complicated. But I think what we can say from a physiological point of view is that once the shoulder itself is going to become frozen, that we're talking about very real kind of adhesions in the joint that stops it from moving. Now, as far as the treatment in the book's concerned, what you do get is you get, I don't want to say immediate, but I'm tempted to, almost immediate pain relief that lasts. So with electroacupuncture, the pain goes. and they get some mobility back in the shoulder. But this mobility is 20–30%. So
start.
Sorry?
It's a start.
Oh, it's a start. And of course, from their point of view, getting them out of pain is, you know, is fantastic.
Yeah.
But yeah, it's such an interesting joint, you know. You know, it's one of those joints that's relying on so many muscles just to hold it together. So it's not surprising that it can lead to problems.
Absolutely.
So your question, yeah, I think with any of these techniques that that are in the book, the main kind of thrust of the treatment is that the electricity doesn't run superficially in the tissue of the body, that the electricity is actually moving through the joint itself. And this is done through a number of different directions using different points. So, you know, we would attach I don't like to call them electrodes because it sounds dreadful. I'll call it a clip. We attach a clip to, you know, colon 16 to 14. And then from channeling, the extra point at the front, through to small intestine 10. That would be a very simple treatment. But also to get more into the actual rotator cuff and the capsule here, then I would do, so that was the basic treatment. So the other treatment would be small intestine 10 to large intestine 15, and then triple heater 14 to, what is it? It's 14 to colon 15, and oh gosh, I've forgotten. It's because I'm on camera. You'll have to look in the book. It's gone for some reason. So yeah, so then use more localized points around here to actually direct the electricity through the joint itself.
And do you use deep needling for that?
Not particularly. And also, well, there's certain joints you do need to use deep needling, and that would be the hip joint. Not so much the shoulder. Small intestine 10 would be fairly deep, but colon 15, not particularly. So yeah. And the other thing about using electroacupuncture, you don't necessarily have to get de chi on every point. Because you're stimulating them electrically anyway, you may be using quite a lot of points. So you don't particularly want to go around initiating, you know, getting de chi, because that can perhaps become just a bit uncomfortable for a patient. So I tend not to do that if I'm using electroacupuncture, because the whole experience is much, perhaps more pleasant, and it's unnecessary to get de chi. That's what I would say.
Do you ever use 2 clips on 1 needle?
Yes, but you do have to be careful. So there is a treatment that I do to treat the psoas muscle, which is a muscle that runs from the transverse processes of the spine and also from the vertebral bodies themselves. So the psoas, well, you obviously know this, but other people might not. It comes from the transverse processes. It joins together in one muscles, and then it inserts on the medial side of the femur, just below the trochanter. Now, this is a very difficult muscle to treat from an acupuncture point of view. There are methods, but I think some of them are dangerous and some of them are improbable in their effect. So it's possible to pass electricity from the back of the right through to the front in the psoas muscle insertion in the femur. Now, these kind of patients will be having back problems where they find it difficult to stand up and they might just feel it on one side. So they'll tend to be bent over, and it will take them time to stand up slowly. This can be caused by just sitting a lot, you know, a job working on your computer. So with this particular treatment, I have changed it since the book. I put a needle in at in the Wato Jaji points, L1, L2, and L3, and then put one needle into the insertion of the femur at the front. So then I will attach 3 clips to the needles on the back, and then all 3 clips to the needle on the front. But what you must do is put all the black clips or all the red clips at the back and all the other colored clips at the front. Now, the reason for this is because in my mind, it may damage the machine, because the alternating current will be going in different directions in each pair of wires. So I would tend to put all the clips on one side.
Thank you very much.
So your question was what? Because I think we went off at a bit of a tangent there.
No, the question whether you can use 2 clips on one needle. If you,
that's one specific circumstance that I do it, but I can't. Yeah, that's probably the only one. I can't see any reason why I would do it.
No, you just mentioned small intestine 10 to colon 15 in the shoulder, and then 3 heater 14 to colon 15. So, you know, there were 2 colon 15s in there.
Going from large intestine 16 to 14, and then the sort of advanced treatment is, yeah, small intestine 10 to large intestine 15, and then triple heater 14 to Jana-Ling. So obviously you don't want to be doing those 2 treatments from front to back at the same time. I think it was the fact that I also used Jana-Ling.
Okay.
So Jana-Ling to small intestine 10 is going more directly through the shoulder joint, whereas the other ones are going more around the upper part of the joint.
Okay.
Yeah.
Good. Thank you.
Okay, pleasure.
Okay, I think for now we might have got through all of the questions, Stephen.
Okay, great.
Thank you, Stephen, very much for your time, and thank you to everybody who joined the meeting.